Imagine a world where simple, everyday changes could dramatically reduce the risk of one of the most widespread chronic diseases. That's exactly what researchers have uncovered. 3 straightforward adjustments to daily habits that can slash your chances of developing type 2 diabetes by an impressive 31%. But here's where it gets intriguing. These tweaks aren't just about eating better. They also involve moving more and getting the right kind of support. This groundbreaking discovery comes from PREDIMED-Plus, Europe's largest ever clinical trial focused on nutrition and lifestyle interventions. The study provides compelling evidence that pairing a Mediterranean-style diet with reduced calorie consumption, moderate physical activity, and professional guidance for weight loss creates a powerful formula for reducing diabetes risk. Published in the Annals of Internal Medicine on August 25, 2025. This research involved collaboration between scientists at Harvard Th. Chan School of Public Health and institutions across Spain. We are in the midst of a global crisis when it comes to diabetes, said Frank Hugh, co-author of the study, and Frederick J. Stair, professor of nutrition and epidemiology. Our findings offer hope, a roadmap showing how small but consistent shifts in diet and lifestyle can prevent millions of cases worldwide. And this is the part most people miss. These changes don't require drastic sacrifices or extreme measures. They're achievable, sustainable, and backed by rigorous science. For decades, the Mediterranean diet has been celebrated as a cornerstone of good health. Rich in fruits, vegetables, whole grains, and healthy fats like olive oil, while limiting red meat and processed foods, this dietary pattern has long been associated with improved insulin sensitivity and reduced inflammation, key factors in lowering the risk of type 2 diabetes. However, the PREDIMED-Plus team wanted to explore whether combining this already beneficial diet with other healthy behaviors would amplify its protective effects. To test their hypothesis, researchers recruited 4,746 participants aged 55 to 75 who were overweight or obese and had metabolic syndrome but did not yet have type 2 diabetes. These individuals were randomly assigned to 2 groups, an intervention group and a control group. Over 6 years, both groups followed a Mediterranean diet, but there was a crucial difference. The intervention group also cut their daily caloric intake by approximately 600 calories, engaged in regular moderate exercise, such as brisk walking and strength training routines, and received personalized support for managing their weight. Meanwhile, the control group stuck to the Mediterranean diet alone without any additional restrictions or structured activities. The results? Those in the intervention group enjoyed a remarkable 31% reduction in their risk of developing type 2 diabetes compared to the control group. On top of that, they achieved tangible physical improvements, shedding an average of 3.3 kilograms, about 7 pounds, and trimming their waistlines by 3.6 centimeters, just over an inch. In contrast, the control group saw minimal changes, losing only 0.6 kilograms and reducing their waist measurements by a mere 0.3 centimeters. What this means in real-world terms is significant, explained Miguel Martinez Gonzalez, another co-author of the study and professor at the University of Navarra. By incorporating calorie control and increased movement alongside the Mediterranean diet, we prevented roughly 3 out of every 100 participants from developing diabetes, a clear win for public health. But let's pause for a moment and consider something controversial. Should governments and healthcare systems prioritize funding programs that promote these kinds of lifestyle interventions? Or do you think individual responsibility should remain the primary focus? This question sparks debate because it touches on broader issues of accessibility, equity, and accountability in healthcare. What's your take? Funding for this landmark study came from prestigious organizations including the European Research Council, the Spanish National Institute of Health, the Biomedical Research Networking Center, CBER, and the U.S. National Institute of Diabetes and Digestive and Kidney Diseases, grant number 1R01DK127601. As always, further research will help refine these findings, but one thing is certain: prevention through lifestyle change works, and it's within reach for many of us.